Who am I here with today?
Hi, I'm Pam Hockerson, and I am a labor and delivery nurse.
What is a weakness you have?
My weaknesses are I am not a morning person, so I like to work night shift. I am very detail oriented, so I like things to be very organized.
What educational path brought you to your career?
Um, 4 years of college to become a nurse. I told you it took me 7 years to do that, and that's because at first I did the pre-med biology track, and I did 3 years of that before I realized I wanted to be a nurse instead of a doctor. I had to take an additional year to do the prerequisite courses for nursing. That took some time, and then the rest of the nursing um, actual program was 2 years of clinical work and courses. So overall it took me about 7 years, but it usually generally only takes 4 if you follow the right path.
Are there benefits of continuing your education while in your current career?
Yes, as a nurse you always want to continue your education because the medical field is always changing. There's new ways to take care of patients and treat patients. We live by evidence-based practice, and so you must be up to date on what the new thing is or what's the best way to take care of your patient or treat your patient's medical condition. Like right now, currently, I am finishing my master's degree in nursing to become a family nurse practitioner. And that's because I want more autonomy. I want to be able to have my own patients and come up with their own plan of care. But there's benefits in going back to school for that because one, you make more money, and two, you have more knowledge to do your job better. And so it's important to always continue your education. You don't just stop at one point.
How did you finance your education?
I had scholarships, but it did not cover everything. I did do a work study program every semester. I worked in the admissions office. I did have some small little side jobs. I used to babysit a lot. I also did hair on the side. And that was just money to help me take care of myself too, because when you're in college you have to not only have money to pay for college, but you need money to take care of yourself too. So what else did I did have some student loans. I qualified for some of the grants, and the student loans were government loans. So just kind of a mixture. Just be prepared to, if you don't get a full scholarship, be prepared to have a plan on how you're gonna pay for your college. Some people get jobs and they pay their tuition costs separately. Try to find all the scholarships you can. Try to just have different multiple streams of income and resources. Don't be afraid to ask the financial aid department for resources too.
What advice would you give to someone interested in this field?
Shadow a nurse and find out whether or not if that's what you like. There's so many different jobs in nursing, so it's very versatile. So if you don't like one particular position or job or thing, you can always try something else.
What is your greatest career strength?
I'm I'm personable. I can easily build relationships with people. I get along very well with everybody, so I feel like I kind of fit in easier. My knowledge, my experiences I've been a nurse for 12 years now. Just having experience in nursing is a strength.
When was the moment you realized you loved your job?
I don't think there was like a special moment. Just with experience and doing the job, I realized how much joy it gives me to help families bring their new babies into the world and start their families. It's just the experiences you have over time help me understand that I love my job.
What are the pros and cons to your job?
The cons, I work long hours. I work 12-hour shifts. That's pretty much it. Pros, I love my job. I deliver babies, help families. I work 3 days a week, and so I'm off 4 days a week, and that's time I get to spend with my family.
If you could go back, what is one thing you would do differently?
Finish school to begin with. It took me 7 years to become a nurse, and it normally takes 4. I had some obstacles along the way, like I got pregnant my junior year of college.